to Tea with Terry Season 2. I am so incredibly honored first that you all have said that y'all want some more piping hot tea. And I couldn't think of any way of starting this off without having my guest that I have here who needs no introduction. I'm actually going to allow them to introduce themselves because y'all heard me talk way too much. So go ahead, introduce yourself to the audience and tell us a little bit about yourself and who you are.
Thank you. Hey y'all, my name is Milani. I am one of the cast members, along with Terry, of HIV and the Journey Towards Zero, Part 2 and 3. I am a community member, activist, drag queen, performer. I do a lot of things. Beauty pageants is my thing. But yeah, so I am currently working at CALOR, which is part of the HIV Foundation. I'm the navigator for social support services there. And I'm also a community ambassador for CDC's Stop HIV Together program, which is a national program of community leaders. And I'm on a lot of projects, but I'm so happy that I'm here today, so thank you for having me, Terry. Yeah, that's my little intro.
Thank you so much for coming. Part of why I wanted to have this conversation is one, because you do so much in the community, and you mentioned that you were part of Part 1 and Part 2, and you are my fellow cast member of Journey to Zero in HIV, and I think that I wanted to have a conversation about an experience that I'm having that you highlight in the film for Part 2. So a little bit of my story, I know I've shared it with you, but I'll share it with our lovely guests. Again, thank you all for joining us. In March, I tested positive for HIV. I am a person who has been on the injectable PrEP for the last 6 months, and it did not work for me. What we know about all vaccines or medications, the effective rate. There's a 99.9% effective rate for PrEP. But that 1% for people like me just means that taking the medication did not work. Now, 1% is a very, very small number, and I don't want to scare people out there, but I do want to talk about this experience because in our communities, I think we talk about the effectiveness of PrEP and how we use it in community as a tool, but I do want to share a little of my story and hoping that, someone else can use some of the knowledge that I share. So, my story, and I guess my first question to you is, in Part 2 of the film, you talk about how it was for you to date a person in the work who seroconverted in a relationship you had with your boss. Can you talk more to us about how important it is to be a person living with HIV and to have a really good relationship with your employer or the person that you're working with while doing this type of work?
Thank you, Terry. Well, first of all, I do want to commend you for sharing your story because I know it would take a lot of courage to come out as HIV positive publicly. So I want to first say thank you for sharing your story. It's difficult coming out, especially doing the work in the community, the work that we've been doing. So I completely understand what you're going through, and I also don't understand what you're going through because although we share similar stories, we're not exactly the same.
Exactly. I appreciate you saying that too.
So in Part 2 of HIV and Journey Towards Zero, I talked about how I came out positive while I was working in the field. So when actually I came out, I turned out to be HIV positive when I was working in a nightclub scene. Mm-hmm. So still have 2 amazing bosses. So it was very important to have the support from my boss from the nightclub scene when I was working at Hydrate because he's the one who set the Uber for me to go to Howard Brown and get checked out, which wasn't even for HIV. It wasn't even in my mind. It was for something else, but they ended up testing me there. And he was actually the first person who I called, and the first person who I let them know that my results were. Well, the reason why I've been sick was because I was HIV positive. So it definitely helped that I told my boss because he understood why I was acting the way I was acting, why the next things that happened with me ended up happening. And he, you know, he really understood me. And even working in the HIV field and going back working in the HIV field full time compared to full time in the nightclub, I still have another amazing boss that does show me a lot of love and support. And that is very, very important to have a good support system, not just with friends, not just with family, but when it comes to your employer. Like that is so, so crucial for a good health outcome. Because if it wasn't for both of my bosses from Hydrate and from Calor, I probably wouldn't be here today. And I say that because there's so many things that have happened between both jobs where, you know, I suffered with substance use disorder, being suicidal, being sexually assaulted, relapsing, you know, all these things that would immediately make an employer fire you, right? Yeah. So I've been very fortunate, very lucky that I've had amazing people as my support system, as bosses, showing me that love and support because, you know, it's helped me with my journey towards recovery, my journey towards being undetectable. And even nowadays, you know, I still have the same love and support from all my bosses all across all my jobs.
I appreciate you saying that. There's so much to the work that we do that allows us that sometimes we have to put so much of ourselves away, and I feel you show up so much as yourself in this work, which is actually so beneficial for the connections you make. I think for me, and this is a question that I do have for you, is I dealt with a lot of anger, you know, when I had my when I got my diagnosis. I'm so angry. I felt as though, like you said, I had those same similar feelings. I let my community down. I was angry that I was taking PrEP and I still came in contact with HIV. God knows I was angry at every person I had had sex with ever. But I was really, really angry at myself, and I saw myself do a lot of I call it coping, but it is self-destructive tendencies just to cope with some of those feelings. And I kind of want to talk to you about that. Like, what is it like being in that place, and what does it take to pull yourself out of that place, you know?
I want to tell you the same thing that my friend Pedro told me before I answer the question. I've been wanting to tell you, I'm so glad that we're having this conversation. Just because you are HIV positive does not erase all the work you've already done for your community. I want you to engrave that in your brain and in your heart. That helped me snap out of it. You know? Because yes, you're right. If we feel ashamed, like, you know, and we've had a brief conversation about the shame we felt, the anger that we felt when we came out to be positive, because, you know, like I mentioned in the film, like, how is it that I'm over here doing all these workshops, Safer Sex workshops, presenting at the U.S. Conference on HIV and AIDS, and then I call myself a dumbass, a pendeja, that, you know, I came out HIV positive, like how? But back to your question, it literally does take a whole village. Like, we cannot do this on our own. We cannot, like, honestly, like, it will take a group of friends, chosen and biological family, if possible. You know, it takes a lot of, whatever religion anyone has, it takes a lot of faith. Yeah. It takes a lot of faith. And you know what, like, here's the thing, it's like, it's not easy. We're not gonna snap out of it from one day to the other. Right. You know, it took, I struggled for the past 5 years with substance use disorder. I've struggled with so many things that come along with being HIV positive. But it definitely takes, for me, it took my family, living back with them, going back to my parents. Now I feel like I never want to leave them. Like, they're stuck with me. Yeah. They are stuck with me. And in a way, it kind of brought us closer to my parents, to my siblings. I'm the oldest of 7. They really do look out for me. I mean, my parents drive me to my doctor's appointments. You know, like any surgery or any, you know, like the times I've had to end up in the hospital because I've had several hospital visits in the last 5 years. I have like some of my daughters. I have Maya, like Serena. I've had it really takes an entire village. You know, you can't do this by yourself.
Yeah, I'm so glad you speak to like the whole village aspect of it because I think that when you're doing this work, you really do feel like you got a large community and people that care about you. But I think for me, I had to like reach out, and I didn't have a lot of people reach out to me because I was very public with like my status and my diagnosis because of the platform I have, and I'm not ashamed of being a person living with HIV, but I needed to take some time for myself, and I needed to explain to my community that in a way, I needed them. So I've had it's been so important to have people pour into me. Fellow cast members have called me and checked in and been supportive. I think that when I think about community, I think about some of those HIV resources and how to navigate those resources as someone who is not only newly diagnosed, but also you work in these fields. So some of these people you see it at conferences and things, and I think for me, it's been it's not embarrassing, but it's so like this feeling of almost re-traumatizing because I have to retell my story, but my community never makes me feel bad about it. I think that where I felt bad about it, it's come from myself and how I believe my life was supposed to go, and I think you say in the film, when you get an HIV diagnosis, it's also a mental health diagnosis. I think that was something I could not truly appreciate until I got my diagnosis because I knew immediately my mental health was suffering. And I didn't want to talk about that first initial, like, I remember I was in such a state of shock, I cried when I first was told, but I was also just in this place of like shock. And I've come out of it now, but I want to talk about like how just debilitating that has been, and I think that in spaces you talked about like what that's been like for you with substance use, and I've had my own experience with trying to battle my substance use issue. What can you say helps on those days when you just don't want to do it? You just don't want to fight the battle,
It's taking a lot of therapy. I'll be honest with you. A lot of programs. And I love that you brought up mental health because sometimes people, like in the audience, in the public, when they see us, we might show this faith that we're okay, that we're fabulous and glamorous and, looking cute or whatever, but in the inside, behind the stage, we're suffering.
Oh yeah.
We're suffering. And to answer your question, what helped me get out of it, honestly, sometimes I do know, sometimes I don't. Like, not only has therapy helped, but just the willingness of remembering that I am somebody.
Right.
Because I'm not gonna lie to you. Sometimes I feel so down that I feel like forgotten.
Yeah.
Sometimes I feel forgotten in the drag scene. Sometimes I feel forgotten in the community. Sometimes, you wake up feeling like that. And you have to constantly remind yourself and in a way kind of talk to yourself. Like, tell yourself like, you are good enough. You are somebody.
Yeah.
You're important to people. And I have to go back and retract phrases that friends have told me, like, you're a badass bitch.
Yeah.
A lot of people look up to you, or, we still need you here. That is one of the biggest things. Like, when I've been suicidal and I've had to end up in hospitals, when I've had these manic episodes, like when my friends reach out to me and they tell me like, bitch, get it together, like we still need you here, like there's still so much work for you to do. So, little phrases like that we sometimes forget that our friends have told us. So even that would be some advice I would give you. Like, just remember good things from people that have told you. And never forget that you are a badass bitch, Terry. Never forget that. We sometimes might forget it, and our brain is trying to tell us like, like we're not, but don't feel that way. Don't feel like you're not somebody. Like you're not maybe a rich somebody.
I'm
but
rich
we
and
are
other
somebody.
things. I think that you give me a lot of joy when we talk about this, because I think that I don't know anybody else who can kind of talk to, who I feel comfortable talking to my story about in the same way. I think that as someone who's Black living with HIV, it is something that my fight was to be the one that did not have HIV.
You don't want to become a statistic.
Exactly.
That's exactly how I felt. I'm like, when I got diagnosed, I'm like, here I go becoming another statistic.
And I was like, I beat the statistic of going good in prison, but now I got the statistic of having HIV, and I think that I really had to change the way I view the world. I think that how I show up for myself has changed a lot, and it's changing every day. I think it's important for folks to know I was diagnosed on March 28th, 2014, Good Friday. It wasn't the best Friday for me, but with all that being said, I'm just 3 months into it, and some days are easier than others, and I think what I'm trying to remind myself is, one, to take care of myself. I think that's super important. But also, like, my space in this world means something when people come up to me and they want to talk about, like, HIV, or they have questions. I think that I don't feel that a lot of times, but I have to remind myself that it still exists, and there are still people, and I appreciate you saying that. I think I keep coming back to you in this film for part 2 because, again, I've been watching it and looking at it in such a different way, and it's like experiencing your story in a different way. And I think that another point that you spoke on, that you just spoke on, is checking in on people who do the work. I think that I am a person that I go through so many other things that I just put stuff, I compartmentalize things. So with that being said, a lot of times I do need someone to check in and just say, how's everything going? If you need anything, the person that suffers with food security, I'm a student, and all these things. And coupled with the fact that I'm now living with HIV, I think that it's showing up for myself has never been so hard, and that checking in on people who do the work is so important. I think that we don't talk about the rates of suicide in the queer community, but it is at a staggering rate compared to our counterparts, I think that we also don't talk about burnout in this work. One thing, and I shared this with you, was I work in a space where we do a lot of research studies with people living with HIV, and for a week, I had to readjust how I was asking questions. I was uncomfortable asking questions. There's a question that stands out to me in my mind that I still think about is, do you think your HIV status has changed your standing in the community? And that was a question I struggled with for a long time. And you've given me a lot to think about, like, it doesn't, and I appreciate you saying that. I think we talk about this journey to zero. We have all these amazing tools and all these amazing ways of getting there. What is something you think would be instrumental in getting to zero?
Oh, okay. I love that you're asking me this, because my next point that I wanted to bring up was how vocal you were on social media when you share that you were positive but also how you were trying to navigate resources.
Yeah.
Oh my God! Like I'm like like I'm scrolling through social media and I will see your post and I'm like, thank you, Terry. Thank you, because so many of us that are positive still struggle to find specific resources that we need. Like it's not nothing is dandy and like, and we know this already. We know this because we work in the field. But it's a whole different ballgame being the one on the other side, looking for resources.
Oh yeah.
Like when you were talking about housing and how pissed off you were about how you were
Let's
struggling.
get into that real quick.
Yes.
Before we get
Yes.
to the question of how do we get to zero, let's back up because I'm glad you brought up that point because, wow. I have had the hardest time navigating services, and one thing that I realized is they don't exist in the way that we are advertising them, or they are drastically being cut by policy, procedures, laws. What does that say for people living? What does that say to people living with HIV? Because I know what it says to me, but and I can talk about that experience. But I got you here because I want to hear what you got to say.
This is why people burn out, because we are also in the forefront of like studying these policies and looking at the news and looking at articles about all these like fundings being cut by government and politicians, and like it takes a toll on our mental health. So it's already taking a toll on our mental health as people providing services, and I feel like it takes an even bigger toll on people trying to receive these services.
Yeah.
So yeah, like it's like I said, it's a whole different ballgame. And when you were bringing up about like housing resources, what was going in the back of my head too, I'm like, at least Terry has a chance. And I say this because as an undocumented person, I don't have any type of housing opportunities because of my immigration status. So, and I just read something today on social media that it says, oftentimes the LGBTQ community forgets about the undocumented community, as well as the undocumented community forgets about the LGBTQ community.
Wow, that's powerful.
And I'm like, so when you were looking for stuff like resources, I'm like, at least Terry has a chance of hopefully getting something, and I'm like, and then I look at not just myself but other people that are in my same situation, like we're fucked. We can't get housing resources, like. There's so many things that I'm still learning. About like how to navigate the health insurance part and how to navigate all the resources that are available. But yeah, that phrase that like one community forgets about the other one. And same thing with us. Like sometimes our own community forgets about us. About the ones that are positive.
And I think that my experience has been one, I want to thank you for bringing up like our undocumented brothers and sisters and non-binary folks, because they are part. When we think about pride, we need to also include some of those conversations. We need to understand that if literature isn't written in a language that you understand or you can read, how is it for you? Same thing if people don't speak the language of your native tongue, how do you access those resources? Also, laws and policies and procedures that are built against people who are not from this country that says if you can't present an ID, we can't give you certain resources. That's something that I don't struggle with. I think that that's something that I still highlight though, because it still exists. And a lot of times people who are queer and they are coming to spaces like Chicago, New York, they are looking for sanctuary cities, safety for persecution that they don't get in their countries or by their government. So, one, I want to appreciate you bringing that up. I think that some of even the experiences that I've had is I've gone to a place just for a gift card, and gift card's been empty, and I've had to scream and shout about it and go back and re-experience it and get a new gift card. And I want to say, even in that experience, what really helped it was how the agency that I was working with work with, like, this is so horrible, I'm sorry this happened, what comes to you? That's incredible. That also rebuilt my trust with that agency. That does not happen all the time. I've been in spaces even to this day, I'm still waiting for housing resources because when I seroconverted, I was sick in January. Did not know why. People thought it was COVID, but I missed a lot of work. I wasn't able to pay bills, and I'm in a place where I'm still trying to pick up, like, how do I, like, pay this bill and pick this up? And there are resources that are for people living with HIV that are either just, the wait list is so long. There's only one agency that offers the money for all these other agencies to do it, and if they don't give them the money to do it, then they can't. So there's this level of bureaucracy when it comes to resources and it comes to how we help people living with HIV that I've never had to experience until I was living with HIV. So I think about this and it comes back to my question, what are your thoughts about how do we get to zero and what do you feel it would take us to get there?
Oh, okay. So it's going to take a lot of work for us to get to zero. And it sucks that we have to rely on funding.
Yeah.
But it's really, really, a lot of it has to deal with funding. Where is funding being allocated? How much people are going to be getting? And when I say funding, I'm talking about like from government agencies, community-based organizations, grants, anything from big organizations to small organizations.
Yeah.
You know, like, I mean, the LGBT community has always been on our time.
Mm-hmm.
And even if we eliminate the LGBTQ portion, we're talking about people's health.
Yeah.
So even if in a different world where LGBTQ people didn't exist but HIV still did, we still would need those resources and policies and in order to get to zero.
Exactly.
You know, so we can't just, you know, blame these politicians can't just blame it on LGBTQ folks.
Right.
You know? And they can't prevent people getting services just because they're LGBTQ, but they are.
Mm-hmm.
So in order for us to get to zero, like one of the biggest things that I'm always gonna bring up is racism. Racism is such a public health threat. Like, oh my God, and I'm talking about racism too, like Black and brown folks and other ethnicities. You know, like, it's something that I never really paid attention before, but now I'm paying more closer attention to how, like, you know, certain groups get certain services.
Mm-hmm.
You know, and I talked about it in the film. I talked about white folks on PrEP.
Yes. I'm glad you brought that up too, because I think that you're right. One of my biggest things is about getting to zero is that we have to address that racism is a huge public health crisis. It also shapes how we create laws and policies. I want to quote loosely here, Moya Scott Bailey. She's an incredible author. She talks about misogyny, noir, transform, and looking at how we use like racism or how our negative views of Black women and how it shaped policy. So if you look at, for example, welfare. This idea of what like the welfare queen and like this Black woman who just wants to live off the government and get a bunch of babies. But if you look at the actual number of people on welfare, it actually helps more white people. But because you create that stereotype, that image, it actually creates policies that gut those things down. And the same thing happens to people living with HIV. When you create negative like stereotypes or this idea that like we're moved, like I think it's this idea for queer people that we've made it, or HIV doesn't affect our community anymore, and in sad cases it actually do. And I'm a result of that. In 2024, I tested positive for HIV, so it definitely still affects our community.
Yeah.
So yeah, I love your point to racism and having to address that as a public health issue as a way to getting to zero. And my last question for you, and I want to thank you so much for being here, your time, your thoughts, and just how much you poured into me just outside this space. But What are your thoughts about getting to zero? And these are just personal thoughts. Like, what do you feel about it? What does it look like? To you.
I struggle with that answer and the question because I want to be positive about the outcome, but you know what? It varies. I would be honest with you, it varies by day. There's days that I feel, yes, we're gonna get to zero. There's these all this new data and new research and new numbers, but then the next day there's different data, different research, different numbers. So it's very like a roller coaster.
Mm-hmm.
Sometimes I feel, yes, we're gonna get to zero. Sometimes I feel like, damn, this government is not gonna allow us to get to zero. And the thing is that people don't understand how important it is to get to zero, even if we are HIV negative. We're trying to make sure that new cases go down by 90%. That's, a lot of people don't understand. They think zero new cases, but I mean, it's nearly impossible to get to that point.
Thank you for that clarification too.
When we're talking to zero, is reducing HIV rate by 90%. There's days where I feel like, yes, we're going to do it by 2030. There's days that I'm like, it's going to be 2040, 2050. We might need to extend this idea of by when we're going to get to zero. But I'm not going to lose hope.
Right.
That's the thing, like, we can't lose hope.
Right.
I mean, we shouldn't lose hope. We should still try our best to do the work that we've already been doing, continue the work that we're going to be doing, and just go out there and be loud like you have. I really appreciate you being so vocal on social media about like I mentioned, like resources that we need, that we're looking for, that we think are there, or on paper it looks nice, but in reality, like the whole waiting list, the whole there's housing, there's no housing, who can get it, who can't get it, it's gonna take a lot of work, but for the most part, I feel that I'm just gonna say I'm not gonna lose hope.
Thank you so much.
What about you?
I think that for me, when I think about getting to zero, there's a couple of things I think about. I think about the idea that what that looks like for me is being in a space where we have more education around sexual health and we're providing it to everybody and not just some groups. But I think getting to zero looks like we are also giving equitable resources to people. I think about, and I always come back to this, I think about the people who are seeking attempts onto nightly. What does it look like for them to have equitable healthcare resources and people who respect them, And it doesn't look like just giving them tips. It might look like giving them money or just paying their rent. I think that it also may look like giving them access to just free food. What getting to zero looks like for me is actual radical changes. It looks like us doing this work in ways that are rooted in the traditions of this work. I think about the tradition of all LGBT work is grassroots communities coming together, pooling our money together to help support us. And I think that is one of the most crucial bloodline reasons that we can get to zero, but I also think that because we don't rely on it enough, we are going to struggle with getting to zero. And I want to thank you all for joining us today. Milani, do you have any last words for people?
Again, I'm gonna keep saying thank you. I appreciate that you invited me here. I appreciate that you feel comfortable enough to share your story. And I am amazed by you, by how so composed you are, because the first few months were a big struggle for me.
Oh,
You know, so like, and you're still gonna have your days. I'm not gonna lie to you. You're still gonna have your days, but you just have to remember that there's a lot. There's a lot for us to still do. There's a lot of opportunities that are gonna come. There's a lot of good things that will come your way. So yeah, I just wanted to make sure that you know you're gonna be okay.
Yeah.
I mean, we know we're gonna be okay.
Mm-hmm.
But just it's making sure that we don't forget that.
I appreciate that. I think that it really is people like you, people like Dr. Ray from the film, Dr. Ray Lewis, who just had their 61st birthday, which I think is incredible. But it's really like, I look to you. I'm like, you all are still here and been doing the work, and despite those days that I don't want to get up, I will be on Facebook and see that you have an event, that you're going somewhere, you're talking, you're on live, and I think that that's that part of community pouring into somebody else, because it's even when I see other just queer people doing stuff that they love, like the queer balloon show they're doing here in Chicago. I think it's amazing because it is like Black, queer, brown people just finding their space in this world. So I want to thank you all so much for joining us for this episode. We look forward for you to join us for more episodes. Look at the link so you can find information about the documentary HIV in the Journey to Zero. You also can find out more on our Instagram at HIV in Journey to Zero. Look forward to seeing you all for the premiere of part 3. The date is coming soon, and we just want to thank all of you all for viewing. And yes, please come back and have some tea and tears.